Hello, welcome back to Dr. Hayatu's medical session. Today we'll be discussing benign prostatic hyperplasia, or BPH. If you've ever wondered about the causes, symptoms, and treatments for this condition, you're in the right place. Don't forget to subscribe to our channel and ring the notification bell to stay updated on our health content. Let's get started. Benign prostatic hyperplasia, or BPH, is a non-cancerous enlargement of the prostate gland that commonly affects older men. It can lead to urinary problems due to the compression of the urethra, which passes through the prostate. The exact cause of BPH is not well understood, but it is believed to be linked to changes in hormone levels as men age. Factors contributing to BPH include hormonal changes, where an imbalance of sex hormones such as increased levels of dihydrotestosterone and estrogen can stimulate prostate cell growth. Aging also plays a significant role. The risk of BPH increases significantly with age. It rarely causes symptoms before the age of 40, but affects about 50% of men aged 51 to 60 and up to 90% of men over 80. Additionally, having a family history of BPH increases the risk. Lifestyle factors like obesity, lack of physical activity, and certain dietary factors may also contribute to the development of BPH. Symptoms of BPH are typically related to urinary function and include urinary frequency, which is an increased need to urinate, especially at night, known as nocturia. Urgency, or a sudden uncontrollable urge to urinate. A weak stream, which is a decreased strength of the urinary stream. Hesitancy, or difficulty starting urination despite the urge to go. Incomplete emptying, feeling that the bladder is not completely empty after urination. Straining, the need to strain or push to begin urination. And intermittency, which involves starting and stopping several times during urination. To diagnose BPH, a combination of patient history, physical examination, and diagnostic tests are used. Medical history and symptom assessment includes a review of symptoms using tools like the International Prostate Symptom Score. A digital rectal examination is a physical examination where the doctor feels the prostate through the rectal wall to assess its size and condition. Urine tests involve urinalysis to check for infections or other conditions that might cause similar symptoms. Blood tests include the prostate-specific antigen, or PSA test, to rule out prostate cancer, though PSA levels can also be elevated in BPH. Uroflowmetry measures the flow rate of urine to identify any obstruction. The post-void residual volume test measures the amount of urine left in the bladder after urination. Imaging, such as ultrasound or MRI, may be used to visualize the prostate and urinary tract. Lastly, cystoscopy is a procedure using a scope to look inside the urethra and bladder. Management of BPH depends on the severity of symptoms and the degree of inconvenience caused to the patient. Watchful waiting for mild symptoms may involve lifestyle modifications and regular monitoring. Medications include alpha blockers, such as tamsulosin and alfuzosin, which relax the muscles of the prostate and bladder neck to improve urine flow. 5-alpha reductase inhibitors, such as finasteride and dutasteride, shrink the prostate by reducing hormone levels. Combination therapy uses both alpha blockers and 5-alpha reductase inhibitors. Minimally invasive procedures include transurethral microwave thermotherapy, which uses microwaves to heat and destroy excess prostate tissue, transurethral needle ablation, which uses radiofrequency energy to ablate prostate tissue, and laser therapy, where different types of lasers can be used to remove or vaporize prostate tissue. Surgical treatment options include transurethral resection of the prostate, the most common surgery for BPH, where part of the prostate is removed through the urethra. Open or robot-assisted prostatectomy is reserved for very large prostates or when TURP is not suitable. The UroLift system is a newer, less invasive procedure that lifts and holds the enlarged prostate tissue away from the urethra. Lifestyle modifications for BPH include fluid management, such as limiting fluids before bedtime. Dietary changes like reducing intake of caffeine and alcohol. Bladder training involves scheduled bathroom visits to retrain the bladder. Conclusion: benign prostatic hyperplasia is a common condition among older men that can significantly impact quality of life. Early diagnosis and appropriate management are crucial in alleviating symptoms and preventing complications. patients should discuss with their healthcare providers to determine the best individualized treatment plan. If you found this information helpful, subscribe for more health-related content. Thanks for tuning in, and until next time, stay healthy.